It is important for us to know that the prevalence of asthma is high in Africa, and it has the chances of about 7% in the rural setting and 9% in urban setting. Whereas in Nigeria, there is a high prevalence of asthma, which is about 3% in Lagos and 1.1% in Ilorin. Hi everyone, you're welcome to my channel, and on this very video I want to talk about asthma. Asthma is actually a severe and life-threatening medical health condition that should not be overlooked. It's important to note that according to the National Institute of Health, about 334 million people are already suffering from asthma, and about 100 million new cases will be discovered as at 2025. So this shows us how serious it is. And it's important to also note that according to the National Institute of Health, that people from low income and middle income any countries are more prone and likely to come down with asthma. Asthma also have variation in terms of age and gender, because women are estimated to be more prone to asthma, while children are more prone to asthma compared to adults. So what exactly is asthma? Asthma is a chronic reactive airway disorder that produces airway obstruction resulting from bronchospasm, increased mucus secretion, mucosal edema, and airway inflammation. So it is important that we note that this asthma is a common condition or disorder of childhood that can cause problems throughout adulthood. So what exactly are the types of asthma? We have the extrinsic or atopic type of asthma. In this type, these are the ones that the cause are actually traced to the environment. So it could result from things such as reactions to allergens coming from dust, coming from pollen grains, coming from the air that we breathe, that scent in the air we breathe, and then also coming from things such as fumes. And then we have the second type of asthma, which is the non-atopic asthma or the intrinsic asthma. In this type, this is the one that results from within the individual. The factor is within the individual. For instance, disease condition where there is an infection of the bronchus, it can result in asthma. Then we also have the third type of asthma called the mixed asthma. This one is a combination of both the intrinsic asthma as well as the extrinsic asthma. Then we have the fourth one called the drug-induced asthma. This one is a result of certain drug or medication that one uses that will trigger the reaction of asthma or the occurrence of asthma. For instance, aspirin has been pointed out to be a good cause of this very condition. Then we have the next one, which is exercise-induced asthma. This one is a result of engagement in rigorous exercises for about 5 minutes to 20 minutes. It can lead to asthma. We have the last one, which is called the occupational induced asthma. This one is a result of someone who works in an industry or lives close to an industrial site, and it results from the fumes that comes out of the industrial site, which may trigger the airway to react. All right. So just for emphasis sake, it's important that we note that we have 6 major types of asthma, which are the atopic asthma, or also called the extrinsic asthma. This one are those one coming from outside. Then we have the non-atopic asthma or the intrinsic asthma, which is resulting from within the individual. For instance, we mentioned infection. The exercise-induced asthma resulting from engagement or performing rigorous exercises. We have the drug-induced asthma, which is coming as a result of taking certain medication such as aspirin. And then we have the mixed asthma, which is a combination of both the intrinsic and extrinsic asthma. And then the last one is the industrial asthma, occupational asthma, which is a result of either the site where the individual works or living close to industrial site. This will take us to the causes of asthma. A combination of several factors result in asthma, but more common are the various things that we're going to be mentioning. For instance, we have the familial or hereditary causation. So there are persons that can inherit asthma. It's a condition that can actually be inherited. Then we have the next one, which is due to the pediatrics tendency. So children are prone to pick up pollen grains or to pick up factors, dust, or expose themselves to dust or factors that can trigger the occurrence of asthma. We also have the environmental factors, which is as a result of staying in a dirty environment or environment that have these pollen grains that can trigger an allergic reaction, or staying in environment that's dusty or that produces fumes that can trigger an allergic reaction. Now we have factors such as infection or certain disease condition that affects the bronchus or the respiratory tract. We also have fatigue, where the individual is excessively exhausted. It can result in asthma. We also have emotional changes, which is as a result of the endocrine system. It can lead to asthma. Then we also have temperature changes or environments that have high humidity rate. So it can lead to asthma, where the environment is too hot or is too cold. Then we also have the They also have emotional or psychological factors, which is a result of someone hearing a bad news. For instance, it can lead to asthma. We have exercises that are rigorous in nature. It can also lead to asthma. Smoking or substance use disorder can also lead to asthma. We also have other psychological factors that may make the individual to be psychologically stressed out. So this will lead us to the pathophysiology, simply put, how asthma occur. So where the individual is exposed to dust or anything that the individual is actually hypersensitive to, for instance, dust, fumes, perfumes, feathers, and so on, it will stimulate an antibody reaction that will cause certain mast cells to be released. For instance, we have the bradykinins, we have the prostaglandins, and then we have the histamines. This mast cell, their work is for defense. Where there is an irritation or external factor or foreign bodies that come to the respiratory tract, their major function is to protect the respiratory tract. But in this case, it will cause the release of mucus, which will obstruct the airway. At the same time, it will narrow the airway so that those factors or those foreign bodies will not step into the airway. But in this case, it is just an abnormal response where the airway is restricted and it is tightened. And when this is happening, the individual can easily breathe in compared to breathing out. So you will now see that there's difficulty in breathing. And then at the base, at the alveoli, which is at the base of the lungs, there is an obstruction which is resulting from increased secretions and mucus, which does not allow proper ventilation or exchange of carbon dioxide and oxygen at the alveoli. This would further cause hypoxemia, which is deficiency of oxygen in the blood, and then there will be dyspnea resulting from further tightening of the airway, and then there will be restlessness because the individual cannot breathe very well, and some instances the person will be sweating because it's undergoing stress. So this is how asthma actually happens. This will take us to diagnosis of asthma. How can we diagnose asthma? They can actually do X-ray, which will show that the airway is actually having some issues. A test can be done to confirm the presence of high level of immunoglobulin E in the serum, and also there can be high release of eosinophil in the bloodstream. When this asthma is actually occurring, if you take the blood sample of that individual, you will notice a high release of eosinophil. And also there could be other tests such as skin tests to confirm the presence of certain allergen in the body of that individual. How do we manage or treat asthma? It is important for us to know that asthma is not curable, it's only manageable. And there are certain combination therapies that can be done, ranging from medication, ranging from lifestyles, and also the airway airway or ventilation. So how do we do this? Certain medications such as bronchodilators can be used, and then mucolytics can also be given to the individual, and then medications that attack stimulants or irritants can also be given to the individual, but this will be done by the specialist or in the hospital. And also for the oxygen therapy, there will be need for the individual to be placed on oxygen, just that the oxygen will be a low dose so that it doesn't cause irritation of the respiratory tract. And also it's important to note that the humidity of that oxygen should be lower because there is a high release of fluid in the airway, so that it does not compound the whole issue. Then the individual should be positioned very well in an upright way so that he can breathe very well with the upper body up instead of the leg above. All right, and then it's important for us to note that tight clothing should be removed from that individual. Clothing that tighten areas such as the chest, the neck, and so on should be relieved, and then the individual should be placed comfortably. And the next one is that the individual should try as much as possible to keep away from factors that can trigger the onset of asthma. With this, asthma will be effectively handled. It's important that before we end this very video, we know 10 important facts that people may not have known or may have led to misconceptions out there about asthma. One is that asthma is inherited. It's important that we note that it can be inherited. The next thing is that asthma is not curable. It can only be The next is that asthma is not curable. It can only be managed. It's also important for us to know that asthma is non-communicable. It is not a condition that can be transferred from one person to the other. Another thing is that there are various factors that can cause asthma. It's not just one thing. So it's not just maybe because you are exposed to excessive oily food, or you are exposed to a pollen grain, or you are exposed to dust alone. A combination of several factors can cause it. It's also important for us to know that children have high risks for asthma compared to adults. And also, women have high risks to asthma compared to men. And it's important for us to note that asthma cannot be distributed from one person to the other. That is in terms of it not being a communicable disease. It's important for us to also know that asthma does not discriminate, in the sense that whether you are wealthy or from a wealthy home, or you are poor from a poor home, you can actually be at risk for asthma. And it's also important for us to note that asthma cannot be predictable. The onset of asthma cannot be predictable. And it's also important for us to know that urbanization can also lead to asthma, because where the people live in industrial site, those fumes that comes out, those dust that comes out, those residues that comes out from industrial site can put an individual, the community, at risk for asthma. And then it's important for us to know that asthma can also disrupt one's life, and as well as the activities of daily living of this individual. Asthma is also common during winter period. Haven't heard all this. It's important for us to note that the treatment and management of asthma will lead to a healthier society, and that's why all hands must be on deck for proper education for people that are in the rural setting, for people that are not aware of causative factors that can lead to asthma, and then for people that have misconception as to asthma. There is need for proper education, and it's important for the government and non-governmental organization to pull out resources to prevent asthma, and also for the management of asthma. They can provide things such as inhalers for people that are suffering from asthma, which is to relieve the attack before proper management can be given to the individual. If you have any question at this point, you can do well to drop in the comment box. At this point, I would like to appreciate everyone that have watched this video up to this very point. Thank you so much. I look forward to that very moment where this channel becomes your most favorite clip. But for now, stay safe and remain blessed. Cheers.